Hello, I'm Dr. Garlick with Florida Orthopaedic Institute. First, I just want to say my prayers and thoughts go out to everyone that's dealing with this crisis, and we're trying to do what we can to help educate our patients and take care of them in different ways, such as telemedicine. So again, my prayers and thoughts go out to everyone. I'm going to try to teach you about what I do for treatment of knee pain with injections. So first, there's different ways to treat knee pain or arthritis, and many people when they come in to see me have a lot of pain and swelling, and at that point they need some type of intervention, and injections have been really beneficial at helping my patients with pain and getting back to their normal activity. There's really three different types of injections, and I use them for different reasons. The first type is steroid injection. Some people will call it cortisone or glucocorticoids, but what that's done for is it treats patients' pain associated with arthritis or injury. And what it does is actually remove swelling from a knee joint and treat the knee swelling at the point of injury. Many patients have pain just from swelling, and that's why cortisone is used universally. Once the swelling dissipates from a knee joint, patients have significant resolution of their symptoms. So for example, if someone has knee arthritis but is not yet ready for surgery, they may come and see me when their pain becomes excruciating. And what I'll do is withdraw some fluid. This shouldn't look like your knee, but this is without the soft tissue. But this is basically what a knee looks like. And there's the knee joint itself is a pocket. So that pocket goes all the way up the thigh bone to about right here, and then all the way around. You have to think of it like a three-dimensional structure. And there's different ways to get into a joint, but I typically will use an ultrasound machine so I can pinpoint the location of the needle. I'll put the needle in, withdraw fluid, and then inject, for example, steroid into the joint, and the steroid will circulate. And when that circulates and it takes away the swelling, well, some arthritic patients will have benefit and no pain for up to 3 to 4 months. So they just love that, and they can go on with their normal activities and get back to their exercise, etc. The second type of injection doesn't act directly for swelling. It's kind of it flushes out a joint. So that's called hyaluronic acid. So the first was steroid, the second is hyaluronic acid. Other names for that are gel injections, lubricant injections, or viscosupplementation. And that's been used since the 1990s, first used in Japan, and it's what it sounds like. It basically just flushes out all the mediators in the knee that cause pain and swelling. So I don't use it for an acute injury like a steroid would be given for, but I use it for arthritis. And it's different from a steroid. Number one, it doesn't have any bad side effects over a long period of time, which cortisone could have. And secondly, it's just a flushing out, so it has a delayed onset. With cortisone, you'll have almost immediate pain relief. With this, it may take 4 weeks, but it could last for 6 to 12 months. And that's a series typically of 3 injections over 3 weeks. Each injection is given a week apart. And it's the same process. Just we go into a knee, ultrasound guidance. Sometimes we numb the knee, but we inject the lubricant, and the lubricant circulates throughout the knee. Provides benefit for arthritic patients. The final type of injection, so we went through cortisone, the second is the lubricant or hyaluronic acid. And the final are what I call biologic enhancements. So basically taking, without getting too detailed, but taking some of your body's own tissues or blood to inject certain areas to try to get it to heal. Now with the biologic enhancements, it's more about healing. So it's not catabolic where you're breaking down anything like a steroid would do. but it's more healing. So for example, there's stem cells that are in the literature and all over the internet, or something called platelet-rich plasma. And what that is a blood draw. We typically will withdraw 30 or 60 milliliters or cc's of blood. We prepare it by spinning it down really fast and then using some filters to get the good stuff of the blood called the serum, where platelets can be really concentrated. And the platelets, we think, are involved in healing. So this has been used since the early to mid 2000s. It's been initially was used on tendon injuries, but now it's being used a lot more with early arthritis or things like meniscus tears or ligament tears. So that's a summary of different treatments, different types of injections that can be done for the knee or other joints. I hope that was informative, and I hope everyone stays safe, and God bless.